Good afternoon. I'd like to call the meeting of the District Board of Health to order on Thursday, May 22nd at 1 p.m. We'll move to item 1. May we have a roll call, please?
Okay, sorry. Vice Chair Andriola,
Present.
Board Member Anderson.
Here.
Whoops. Oh my gosh. Board Member Brown.
Here.
Board Member Driscoll.
Here.
Dr. Ituarte.
Here.
Dr. Danko is not present, and Chair Reese is not present. We do have a quorum.
Thank you. We'll move now to item number 2. Mr. Driscoll, would you like to do and lead us on with the Pledge of Allegiance, please?
Please join me. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Mr. Driscoll, for doing the honors, and later on the agenda, we'll give you the to-do list.
Thank you, Madam Chair.
So everyone can start thinking about what that might look like. Anyway, we'll move to item number 3, public comment. Do we have any public comment?
I'll read the public comment statement.
I don't know why. May I just interrupt? I don't know, and it's because I'm getting old. I can't even really hear you, so I'm not sure if the mic is on or I need to get a device. Possibly, it's probably a little of both.
Okay, is that better?
That's great. Thank you.
Okay. All public comment is limited to 3 minutes per person and should be addressed to the Board of Health as a whole, not an individual. With the exception of the public comment agenda items, comments will be heard for items labeled for possible action and should be specific to the item being considered by the board. The Board of Health conducts the business of Northern Nevada Public Health and its citizens during its meetings. The presiding officer may order the removal of any person whose statement or other conduct disrupts the orderly, efficient, or safe conduct of the meeting. Warnings against disruptive comments or behavior may or may not be given prior to removal. The viewpoint of a speaker will not be restricted, but reasonable restrictions may be imposed upon the time, place, and manner of speech. Irrelevant and unduly repetitious statements and personal attacks which antagonize or incite others are examples of speech that may be reasonably limited. And there are currently no requests for public comment.
Thank you so much. We'll move now to item 4, approval of the agenda. I'd like to entertain a motion at this time, please.
So moved.
Mr. Brown moved. We have a second?
Second.
Second by Mr. Driscoll. Any further discussion? Hearing none, all in favor signify by saying aye.
Aye.
Any opposed? Motion carries unanimously. We'll move now to item number 5, the most inspirational part, recognitions. Hello, Erin. Thank you.
Good afternoon. Can you hear me?
Yes.
Okay. Good afternoon. For the record, Erin Dixon. I'm here to recognize 4 staff for their years of service. I'd like to start with Lilia Sandoval Huffman. She is an office specialist with 30 years.
Wow.
She supports our WIC program and works with our WIC clients. Cindy Hawks is our office specialist and for 25 years, and she is an integral part of our epidemiology team. We also have Lori Griffey, who is an admin assistant and primarily our human resources rep. She has 20 years of service and is a rock star. And Charmaine Roquet, she is a public health nurse too with community and clinical health services, and she is being recognized for 10 years of service. So quite a number of years recognized today. So
Well, I
thank
just
you.
totaled it. That's a total of 85 years cumulatively.
It's
Wow.
very impressive.
Thank you so much.
Thank you.
Congratulations to everyone. I bet you it would be so interesting hearing the 30 years of office specialists and all the fun that happened over those years. And I was part of that transition with a little thing called a mouse even, right? That used to just be a rodent at the time. So how far we've come. Thank you so much for everybody's service. We'll move now to the Health Heroes.
And I believe that is being presented by Eva Sandoval.
Thank you.
Hello, good afternoon. Can you hear me?
Yes.
Eva Sandoval, and I'm here to recognize the two candidates for our Health Heroes. We have Jim English, and he is deserving of this for recognition for adaptability and collaboration, and Josh Foster for compassion and trustworthiness. Both of them are in our EHS department.
Thank you.
Thank you.
Well, that's a lovely way to start the meeting, just with everybody being so dedicated to a great organization. So thanks to everyone for their service and for their continued efforts in making the Northern Nevada Public Health a great place to work and serve our community. We'll now move to consent items. Does anybody have any item? Mr. Driscoll.
We need to pull 6A because I have an adjustment to the minutes.
Great. So we're going to pull, we have a request to pull 6A. Anybody else want to pull anything? All right. Other than 6A being pulled out of the consent, may I entertain a motion to approve?
Motion to approve items 6B, C, D, and E on the consent agenda.
Thank you. We have a motion by Mr. Driscoll. May I have a second?
Second.
Second by Mr. Anderson. Any further discussion? Hearing none, I'd go ahead and ask everyone who would like to approve this, signify by saying yes or yes.
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 Okay. Any opposed? Motion carries unanimously. So we'll now move to the pulled item under consent 6A. Mr. Driscoll, would you like to address your recommended change?
Yes, thank you, Madam Vice Chair. In the minutes, it shows that I was present for the April 24th meeting. I was not in attendance, so that should be corrected for the record.
Thank you. You were here in spirit.
No.
Oh, you weren't? Okay, well, let the record also reflect that he was really glad he wasn't here now.
Well, I was in a different time zone. I didn't. Thank you.
Thank you. Thank you for the noted change. Hearing that, I'd like to entertain a motion to accept with the change noted.
So moved.
Mr. Driscoll, do we have a second?
Second.
Mr. Brown, any further discussion? Hearing none, all in favor signify by saying aye.
Aye.
Any opposed? Motion carries unanimously. Thank you, Mr. Well, you were really here in spirit, though. I'm going to go with it. We'll move now to item number 7, a recommendation to accept the REMSA Healthy Monthly Franchise Report for April 2025, which includes REMSA's Health Accounts Receivable Summary, compliance by zones, average response times, incident detail reporting, summary penalty, fund reconciliation, ground ambulance operations report, patient's experience report, and comments education report, and public relations report, and provide possible board direction. Thank you, Mr. Duplantis.
Good
Nice seeing you.
Thank you very much. Good afternoon, Vice Chair Andriola and members of the board. I'm Barry Duplantis, CEO and President of REMSA Health for the record. I understand that you've been provided with a copy of REMSA Health's April 2025 report. I'm very pleased to report that for April and for the fiscal year to date, REMSA has exceeded all of its franchise response compliance for all priority 1 calls in all the franchise zones. I would also like to point out, just for point of reference, that in April, REMSA responded to 8,286 priority 1 calls. That works out to be like 276 responses per day. And we ended up transporting 5,340, which is like 178 patients per day that we transport to area hospitals, just to give it a little context in a way that we can certainly understand it. Our customer service report for the month of April resulted in a score of 92.86, which is an improvement from our score of the previous year. So very pleased with that score that came from our patient surveys. And then lastly, I just would simply like to draw attention to the fact that we celebrate EMS Week this week, and we have been very busy in our organization, thanking and recognizing all of the many men and women in our organization that work in the field of EMS. So I just wanted to, express, my pride for all of the men and women nationwide that participate in caring for others. That concludes my report. I'm happy to answer any questions that anyone may have.
Well, before we go to questions, I just want to echo your sentiment in terms of EMS Week and celebrating not only the great work that's done here, but throughout the entire nation, and recognize all of the trained professionals who really are giving of their heart about the service and saving lives and preventing some pretty strong tragedies that could occur without their expertise and promptness to the job at hand. And I had the honor of participating last night in, so did Dr. Kinsley. We both attended, along with many others, the celebration of the heroes at REMSA in recognition of EMS Week. So thank you for that opportunity. Having said that, does anyone have any questions for Mr. Duplantis based on the report?
Vice Chair, I'd like to just note that Dr. Danko joined at 1:05.
Thank you so much. Welcome, Dr. Danko. Do you have any questions? I don't know if you had heard the report. I'll just go to you and see if you have any questions. I do have a quick follow-up question. Thank you so much for the report, and thank you for the breakdown. I'm just wondering, the 178 per day and the numbers that you gave, how does that compare to the previous year, for instance, or any trend? Is it going up or is it going down? I'm just really curious.
It actually is going up. As our community grows, we find that we are seeing about 4, 5, 6%. It just depends.
Okay.
And let me say that right now we're entering into what we consider to be a seasonal rise because more people are active, more people outdoors, more things happen to people. But overall, year over year, for the last several years actually, we've been seeing about anywhere from about a 5 to 7% increase as the community has continued to grow.
Thank you. Well, if there aren't any questions, a big thank you for sharing all the detail and for having a great partnership.
Thank you.
Thank you. We'll move now to item number 8, presentation and discussion regarding the 2025 Public Health Preparedness Report.
Madam Chair, Vice Chair.
Yep.
I believe we need to approve the report.
Do we need to approve that report?
It is.
For possible action, generally the board likes to approve it, but it's helpful.
We'll see why you're so needed, Mr. Driscoll. So you cannot go on vacation anymore.
Yes, ma'am.
Defer, so the board is able to approve this, yes.
Okay, great. So is that in the form of a motion, Mr. Driscoll?
I would like to accept the report as presented.
Great. So do you have a second?
Yes, Dr. Ford.
Dr. Warde, we have a motion and a second. Any further discussion? Hearing none, all those in favor signify by saying aye.
Aye.
Any opposed? Motion carries unanimously. Thank you. Now we'll move to item 8, presentation and discussion regarding the 2025 Public Health Preparedness Report. And I apologize, I'm not sure if I'm going to get your last name, Anastasia Gunawan?
Gunawan, yes.
Oh, thank you. I did something right, Mr. Driscoll.
All right, good afternoon, members of the board. My name is Anastasia Gunawan, statistician for the record. I'm here this afternoon to present the Public Health Preparedness Report on behalf of the Epidemiology and Public Health Preparedness Division. The intent for developing this report is to increase transparency of preparedness, and build community resilience. This publication will be available every 3 years with a focus on evidence-based recommendations for internal planning. We curated the sections in this report to include legal authority for emergency response under NRS 439 and 414. This report also focuses on climate change and hazard risk data that integrate social determinants of health, and NNPH preparedness efforts, including training and applied technical capabilities, which I will highlight in later slides. We also showcase many stories in the field that highlight community-wide efforts toward climate resilience communities in Washoe County. The focus on climate change and public health preparedness starts with a framework for identifying the highest risk hazards related to climate change. For this region, a FEMA model utilizes the live statistical methodology to assign a risk score that reflects a percentile for hazard in a given county. For Washoe County, the highest hazard score based on this model is for flooding and wildfire, followed by extreme heat and severe weather. And most of these hazards do pose a real immediate threat to our community. We had a record-breaking precipitation and snowfall in 2023, and severe weather that created flash flooding in July of 2024. Wildfire with a hazard score of 97 means that the wildfire risk in Washoe County is higher than 97% of all counties in the nation. This is partially due to a large and growing urban-wildland interface as the county continues to grow in population. A model also projects extreme heat to increase in days above 90 degrees Fahrenheit from 2 weeks to up to a month in 2055 in Washoe County. So these hazards cumulatively pose a real immediate threat in our community, especially our vulnerable populations. They are impacted disproportionately. So recent figures shows that 12% of children in Washoe County are living in poverty, and 10% of elderly 65 and over are living alone. So surveillance and training becomes a priority. During an emergency operation and activation, NNPH operates from a set of guidelines in the Emergency Operations Framework, where it outlines incident command system, levels of activations, and roles and responsibilities with our regional partnership. At NNPH, we also utilize CDC Essence system to track near real-time surveillance of health syndromes. The chart here to the right shows a significant uptick in ER visits during Caldor Fire. We also utilize the EM Power dataset to track and monitor at-risk electricity-dependent populations by zip code for rescue and response planning. Our public health preparedness team at NPH also hosts various exercises for emergency training, including the CDC This Is a Test Pod Edition program for community pods exercise. At NPH, we recognize and support initiatives such as emergency exercises for the earthquake preparedness. NPH hosted an earthquake exercise this month with EMS and hospital partners in the region. Our partners also at UNR and DRI released an urban heat map to educate the impact of heat severity in Washoe County. Thank you. At this time, I would welcome any questions that you might have about this report.
Thank you. Does anyone have any questions? Dr. Kinsley, do you want to add something?
Yeah. First, I want testing. First, I want to thank Anastasia for this report and having this data being able to present to the community as well as the District Board of Health. As we move forward, this is something that hasn't been accumulated before, but it puts very concise information and looks at what's a snapshot of our community when we're facing issues or problems or due to these issues and changing weather patterns as well as within our community, and how do we prepare and respond to that. And that is one of the core functions of Northern Nevada Public Health, is that we help we're always that other side of that coin with our first responders, both our fire departments and our police departments that were there when we respond to these emergencies. But thank you for the work on this, and I just want to comment that there's been various exercises for an earthquake. Well, earthquake is not on there. That's one of the one that perhaps keep a lot of us up at night, just because it just destroys infrastructure. And they have done a wonderful, amazing job. And it just wasn't a few partners participating. It was all our partners participating. And it's been a wonderful response, and seeing how we prepare for that, and being able to respond to our communities. So Anastasia, as well as the whole team, just want to say thank you.
Thank you. Anyone else have any comments or questions? Well, I too want to thank you. I think one of the things that people don't realize is prepare, 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 prepare. You do not want to be in a situation and have an on-the-job training. That is not good. And the fact that you even have some trends that are happening, and we all know that, but everybody's partnership is really critical. And I don't know if they still do the shakeout for the earthquakes. Do they still do that? I guess not. So they used to do that. So the whole community would have a day, an earthquake, and it was called a shakeout, and everyone, would participate however they felt in the actual location at the time. I don't know if you have lived here long enough to. Have you seen that, Mr. Brown? Do you remember that? Oh, yeah, okay. Okay, back me up. So,
I remember as well, too. So.
okay, good. So I just didn't know if that was still happening. That might be something fun to think about in the future. But thank you so much for your work. Thank you for providing all of the data and the statistics and unfortunate percentages. That 97%, that's the wrong way, but certainly being prepared and not being in a surprise situation is helpful. So thank you for all your hard work.
Thank you.
All right, well, this is discussion only. And so we'll move now to item number 9, a presentation and possible acceptance of the FY25 Q3 strategic plan results. Ms. Lavoie.
All right, good afternoon, members of the board. Thank you for the opportunity to review with you our strategic plan progress. During the presentation today, I'm going to briefly review the structure of our performance metrics as well as our successes in some areas of continued improvement. NNPH's performance management system is directly supporting our organization's strategic and board-approved goals by helping to translate those broad objectives into actionable and measurable activities. We've adopted a strong practice of using the system to track our progress toward these defined goals, to foster a culture of accountability across the organization, and we're committed to using the system to draw insights that are critical for adapting to our strategies in response to internal and external challenges. Our strategic plan is structured around outcomes, which are those actionable activities that we aim to achieve. As you can see up on the screen, we've done very well, and over 75% of those are on target or are in progress, likely suggesting that we'll be on target for quarter 4. Our outcomes roll into division goals, which are specific to individual divisions. And then we also have our district goals that are agency-wide objectives that require cross-collaboration, and those are really to achieve our long-term impacts that we all aim to achieve. For quarter 3, some things to highlight. We've made considerable strides by expanding NNPH's community outreach and our visibility. Our public-facing programs and campaigns are reaching more residents, particularly through partnerships and targeted engagement efforts centered around sexual health testing and the importance of timely treatment, as well as connecting with the community to raise awareness of air quality conditions. As for operational improvements, we've significantly improved the on-time rate for performance evaluations, which support stronger accountability and staff development, which we're really proud of. So while we're moving in the right direction, staffing limitations continue to remain a significant barrier to meeting some of our targets. Included in your board packet is a status snapshot as well as an outcomes report, so you can look at those particular initiatives that may be in progress or are stalled with some of the context and narrative next to those data points, which will show you which efforts have been redirected. We're encouraged by our progress and the collaborative efforts across all divisions, and as we approach Q4, we'll continue to focus on prioritizing high-impact actions that align with our long-term outcomes, as well as addressing resource and capacity gaps while continuing to reinforce data-driven and a team-oriented culture. And with that, I'll take any questions that you might have.
Thank you. Are any questions for Ms. Lavoie? I have a quick question. I'm wondering, based on the information that you shared, and kudos to, having the outcomes, and I love the whole, even participating in the strategic plan for the first time, it was great to see that thing, that essentially it's goals and then target and then outcomes, and then measuring that along the way. So it's from that context that my question comes. I'm just wondering, in terms of the outcomes, certainly the 76.4 is to be celebrated, and then the other progress, but the off-target of 12.3, and then in terms of the division goals, the off-target of 10, is there any impact of some of the adventures that have been happening with what we're seeing with funding impacting not only, the district, Board of Health, but other organizations? Is that a possible factor? I'm just curious, is that factored into this at all?
Yes, absolutely. So our targets are, we set all of our targets before we head into the fiscal year. And so, during that time point, we were all under the impression that we were going to have, those funds to be able to execute the activities that we established within our outcomes. And so if there is an initiative that is off target, you'll see that in your in your report. And then there's also some context, and I think our staff do a really good job of explaining why those things are off target. So when there are those financial barriers, they do note that there. If it is something more like resources or staffing, they'll also note that as well. So you can find all of the details in the reports.
I'm just throwing out, I don't want to add anything to anybody, but it talks about, possible direction. And I think given the fact that we are in a very challenging situation, it might be, I'm just saying out loud, so it doesn't, I realize the narratives are there, but I'm wondering if it might be helpful that had the projected funding come in, we would have not been off. Does that make sense?
Yes.
If that's possible. If not, it's not a big deal. I'm just throwing that out for consideration. I think it's helpful because looking at the narrative and then me trying to figure out, well, okay, like if it was really off target, it's not 10%, it would have really, if you extrapolate what is not controllable with funding, we're really not, as an example.
Sure.
So I'm not trying to add any additional burden to staff at all. I'm just throwing out an idea. I think it's helpful because it also shows in moving forward as the strategic plan is being planned that when you're comparing usually year to year, right? And you're looking at that, we are in new territory. And I think sometimes just looking at those percentages are easy to look at, but need to be, quantified a bit if possible. So it's just for consideration.
Absolutely. Thank you for the feedback, and we'll take that into consideration when we're reviewing
Thank you.
our Q4 report.
So anything else? Oh, Mr. Driscoll.
Thank you. This is really a question for the health officer. Because everything's in flux, we've done a phenomenal job of identifying and reporting. And we're watching, and we just discussed how we're trying to be flexible. Because of the flux in the situation, priorities are going to possibly be changed. How are we proposing in the overall structure of what we just represented and with your team to be able to sit down as things are firing and looking more real? How are we going to determine priority change, and how would we report that to this board?
Great, thank you. We actually met as part of our leadership structure, part of it, and we are directly addressing this. So yesterday, using a performance management system and looking at how do we prioritize roles. We have to balance to, what's NRS and what's required and what's not. And so going through that and ranking priorities to those decisions and funding, when looking overall funding, the uncertainty of funding and a reduction in funding and staff's overall that. So as a leadership team, sitting there and going through this process, we recently, we have some non-categorical funding coming in that can help us over the next 2 years looking at that, but positioning it correctly that allows us some flexibility if severe changes come in our budget or just a reduction, and how do we address that with our staff. At any time, though, something that will come forward, we will bring to the board, not only that, but our jurisdictional partners. If we lose complete funding in any of our programs by our ILA, we are required to bring it to you as our jurisdictional partners and our board for evaluation on that. And so you would be a part of that process and assessment if any current program, especially the impact on the community. From there, though, we'll always keep you updated on that, and then as leadership, going over those positions and making sure where our resiliency is at within our organization, and we're very good at doing that, at being able to manage a position, doing more with less. But we will get to certain points where we won't be able to do that, and that's where we definitely have to bring to the board. But yes, we are very in the thick of that process right now.
Great.
Yeah.
Thank you. Thanks, Ms. Lavoie.
Thank you. Anything else? Thank you for the presentation and for the information. And this is for possible action, so I'd go ahead and entertain a motion to approve the presentation and the report as submitted.
Dr. Retorti, so moved.
Do I have a second?
Second?
We have a second, motion and a second. Any further discussion? Hearing none, all those in favor signify by saying aye.
Aye.
Any opposed? Motion carries unanimously. Thank you. We'll move now to the next page. Item number 10, discussion and direction to staff regarding the legislative issues proposed by legislatures. It's getting down to the wire.
Yes.
So, hello. Are you surviving? Do you have Red Bull next to you?
I do.
Would you like us to deliver Red Bull next to you?
I'm good today.
Thank you.
Thank you for asking, Bill. So I think we're day 108, I believe, day 108. So this will be very short. There's not a ton of updates because right now the focus is on most of the days are spent in finance committees. So all the bills that got referred, all bills that have any sort of fiscal note have been referred to either Assembly Ways or Means or Senate Finance. So there are a lot of bills that they need to process, and they're typically still in their house of origin. So if they're an Assembly bill, they're still in Assembly Ways and Means. So it means they need to get those out of the fiscal committee onto the floor, voted out, and heard on the other side, all before June 2nd. So things are, it always happens this way, but there's a lot of backlog right now in long Senate committees and long floor sessions. So I'm only going to discuss, I think, 3 bills today. Maybe a couple more. So I'll start with everybody's favorite bill. SB 295 is the street food vendor bill. This was Senator Danyate's. It was heard in Assembly Health and Human Services last Wednesday, I believe. And he did adopt a friendly amendment from me that made the bill livable. So Senator Danyate and the Health and Human Services committees know that public health is still in opposition of this bill. We don't fundamentally believe that lowering food standards is a safe practice, and this could potentially be a huge headache for our environmental health department. However, we had been told that this bill will be moving, so we had to make it livable. So we amended in a piece that essentially is creating kind of a different permitting process for this particular group of sidewalk vendors, where they're not going to go through our whole inspection process, but they will be permitted from us, and they are going to have to put a sticker on the items of food that they are allowed to vend that say they have not been inspected or permitted by like a government agency. I don't have the particular language in front of me, but that bill passed through work session, and that amendment was adopted the other day on the floor. So that is the sidewalk vending bill. We're not thrilled with it, but we did what we could for it. So that is SB 295. I wanted to just briefly update you on a bill called, it's SB 466, and this bill was heard in Senate Health and Human Services the other day. The internet was down in the building, and it was like a 4-minute hearing, and I was waiting outside for it, and they heard it while I was waiting outside for it. I thought the committee was starting, and it started and ended before I even made it in there. But this bill it's okay for us. It's just it's moving environmental health food services from DPBH at the state over to the Department of Ag. So it's just moving the entire chapter over to Ag. So that's SB 466. The other bill of interest, these kind of big overarching bills, is one called SB 494, and that one, it says makes revisions relating to health and human services. And this is the bill that's creating the new health authority. So it's going to be an executive office out of the governor's office, and a woman named Stacy Weeks, who currently runs Medicaid, will be the new director or administrator. I'm not sure what they're going to call her, but it is moving PEB and Medicaid and a couple of other programs into this health authority, with the thought that things like Medicaid and PEB, if we kind of combine those those programs and look at them from a way that can generate revenue for the state. So these are huge populations of people that get their health insurance from PEB, and huge populations of people that get their health insurance under Nevada State Medicaid. So if we can leverage those and create better, better deals for the state when it comes to providing medical services, maybe there's opportunity there. And from what I've heard is Stacy Weeks has done such an amazing job with Medicaid, Nevada State Medicaid, that we have gone from being one of the worst Medicaid servers in the nation to an example for other states. They are looking to see what she's done and mimicking it. I know Arizona and New Mexico have looked into what she's doing. So that's pretty exciting, because she has some ideas about how we can better fund and serve public health throughout the state as well. So this is such a huge bill, but it is being seriously considered, and it will pass. There's still a lot of things in the air, like all of which programs in particular are moving. There's a few up in the air right now. So that's SB 494. The other bill I wanted to mention that was heard in Assembly Ways and Means last Friday that went well was AB 102, and that is the bill that granting permissive language for a public health authority of our size, a health district of our size, to permit and and license our own paramedics and ambulances. So that moved out. It hasn't moved out, I don't believe, but it was heard in Assembly Ways and Means on Friday. And the fiscal note is very small. It's about $24,000 from the state, and it would only be a loss to the state when we implemented it. But it's a big if right now for us, because this program would take money to build that we don't necessarily have right now. So, but we're still in support because it's permissive and it would allow us to do it when we are able. I'm trying to think of sorry, excuse me. I think those are the only bills I really wanted to get into today. There is still a bill that is alive. We don't know, I'm not sure the destiny of it, but it's AB 352. And this bill is problematic for us, and we are in opposition to it. But I think it might be moving anyways. Sometimes that doesn't matter. It's moving. We currently permit cottage foods of people that live and work, have a cottage food business in Washoe County. This would move cottage food back to the state. So this is problematic for us when it comes to our oversight of farmers markets. That's where a lot of people sell cottage food. We're concerned about the lack of staffing at the state, and whether they're going to have somebody on site for all of our temporary events and farmers markets and things like that. So it is a concern. We voiced it, but it does seem like something that the Department of Ag as well as the governor's office is kind of eager for. So it's still in the works, and I don't know the fate of it because it hasn't been heard in the Senate yet. So those are the four or five I really wanted to discuss now. There is one bill. It's called SB 423, and that was the bill that gave an additional $5 million to basically it was an allocation for $5 million that didn't start till fiscal year 2027. And what it did was give each, either local health authority or county, a base funding of $125,000 per year. So $250,000 per county per year. And what we called it was a base funding formula. And this is what other states have implemented in other public health infrastructures to kind of help build out public health, particularly in our smaller counties and our rural areas, so that these counties that are either trying to take on their own public health tasks or even build their own district boards of health would have some sort of sustainable funding. So that bill was heard in Senate Finance yesterday, and it did not go well. The mechanism that was decided on in an interim health committee, which I find interesting, was picked apart by the Senate Committee on Finance yesterday. The agreed on method of how we wanted sustainable funding from it would be to take a very small portion of a revenue stream called the insurance premium tax, which generates about $600 million a year. We wanted to take $5 million out of that, but in a sustainable way. And the Senate Committee on Finance, who have members on the interim health committee, I might add, really went to town on how if we take money out of the insurance premium tax, we're decreasing money out of the general fund. And that's kind of like a poor way to ask for money, like a sneaky way. And I think a lot of people could fundamentally disagree with that, but I will, regardless, it doesn't matter. The hearing did not go well. And Senator Dunyate asked NACO for an amendment, and we have provided the amendment, so it would just be like a general fund appropriation. It still wouldn't start till 2027, so it doesn't really matter. But it was an interesting hearing, and I think we learned some things moving forward about how we approach sustainable funding in the future. So that is my update for this week. We have 12 days left, just trying to get to the finish line with our $15 million in the governor's budget, because we really need it.
Thank you, Ms. Dawson. And tomorrow's a pretty important day.
Tomorrow is I forget what deadline it is. It's a deadline.
It's a deadline.
May 20, I think it's a committee
Yes, out of
floor
the
passage
origin.
deadline.
Yes.
However, so the rules have been waived, I think, in the Senate. And now most bills we are working with have been exempted anyways. So they've been exempted from deadlines. So more things will die tomorrow, but probably not that many. It's kind of like there's no time or days anymore. It's just going to be like a long 2 weeks from here on out.
I hear you. Thank you. Dr. Kinsley, do you have anything to add?
No, thank you.
Well, thank you for all your hard work, and I suppose that there might be a cot or something that you might have and an inventory that you might want to consider. Not that I'm encouraging that to be the case, but thank you for all your hard work. And
Appreciate
thanks
it. Thank
for staying on this, and we'll look forward to seeing what happens in the upcoming
Yes.
days.
12 days. I'll
That's
let
it.
you know. All right. Thank you.
Thank you so much. Okay, we'll go ahead and close item number 10, and we'll move to item number 11, staff reports. 11A is air quality. Mr. Vega?
Thank you, Vice Chair, members of the board. For the record, Francisco Vega, Director of the Air Quality Management Division. Just really quickly, wanted to highlight a few things in my report. I did provide some insight into the impacts of the President's proposed budget on the Air Quality Division, and specifically the grants, the Section 103 and 105 grants that we receive from federal EPA in the sum of around, I believe it was $816, something like that, $816,000. Again, there wasn't enough detail in the proposed budget to determine what the actual impacts are, but that is something that we are watching very closely. Let's see. Also, for the month of April, I'm happy to report we had no exceedances of the air quality standards. And then on the plan review side, we reviewed 69 plans, and 100% of those were reviewed in a timely manner. That is my update. Happy to answer any kind of questions.
Thank you, Mr. Vega. Any questions for Mr. Vega? Thank you so much for the report.
Yep, thank you.
We'll move now to 11B, Community and Clinical Health Services. Ms. Shepherd.
Good afternoon. Christina Shepherd for the record, Division Director of Community and Clinical Health Services. I'm the new Division Director for CCHS. I missed our last meeting because I was at a grant writing course, so apologize for that. But I wanted to introduce myself briefly. I've been with Washoe County since 2016 as a nurse practitioner. In 2022, I was promoted to the nurse practitioner supervisor position for the Family Planning and Sexual Health Clinic, and at the same time implemented our community health worker program. As a Reno native and fifth-generation Nevadan, I feel really privileged to be able to provide leadership to the dedicated staff of CCHS who work tirelessly every day to promote and protect the health of our community. So I'm really happy to be here. I don't have anything to add for my report, but I would like to provide one additional update. We celebrated Nurses Week earlier this month, and I would like to give a special recognition to our senior public health nurse, Kaylee Barrett. She was recognized as the Northern Nevada Nurse of Achievement for Rural and Community Health. It's kind of like, it's a big event. There were over 1,300 people nominated, 700 people accepted their nomination, and she won in rural and community health. So she is an amazing nurse, and we're so happy that she was awarded that. I'm here to answer any questions you might have. Thank you.
Thank you. Well, congratulations. That's quite an accomplishment for her. Any questions? Hearing no questions, thank you,
Thank you.
and congratulations on being here since 2016. Thank you. We'll move now to 11C, Environmental Health Service Program. Mr. Fida.
Good afternoon, board members. Robert Fida for the record. You have my report in front of you. I wanted to highlight a few things, a few of our educational campaigns that we've been doing. So our food safety program, they hosted their inspection boot camp on the 28th. We had 21 people attend from 13 different restaurants in the community. So it was very successful. Another community event we had is our land development team partnered with RCAC, the Rural Community Assistance Corporation, and they were hosting educational classes on septics and wells, and we had about 15 attendees for each class. Some other updates is we are currently hiring for public service interns. These are the folks that will kind of be doing the vector surveillance for the community. So we're in the process of recruiting those folks at this point in time. Plan review update for this month. 100% of our plans actually made their goal. But also, we are also almost 20% down from previous year. So plans are on the decline for us as well. And then I think that's everything I have for my updates. I'll open it up for the board.
Thank you. Any questions? No questions. I just have a question on the food safety boot camp. I know that it's been pretty successful. Is this like the third? I don't know how many.
This would be, I believe, the second iteration of the boot camp. So I think we're trying to go for quarterly with this one.
Okay,
So.
thanks. I mean, it's still new. And I was just curious, what kind of feedback? It seems like people are attending, that's great, but are you garnering any feedback? I was curious in terms of whether they feel it's helpful or.
We've gotten feedback from the first class. I have not seen feedback from the second class yet. So, but generally, it's been positive feedback.
Okay.
So.
I have heard from an attendee of the first class that just from a very experienced person in the food industry who really had nothing but great things to say about it. So kudos to you for continuing that and continuing the outreach to give people as much information as possible. So everybody wants everyone to be compliant, and more information the better. So thank you.
I'll let the team know.
Thank you. We'll move now to item 11D, epidemiology and public health preparedness. Dr. Dale? Did I say that right?
Dow. Close.
Dang. Sorry, I apologize.
Good afternoon. Ms. Vice Chair, members of the board, for the record, Nancy Dow, Division Director of Epidemiology and Public Health Preparedness. You have my report, nothing to change or add, but I do have just a few highlights more pertaining to the month of May. So as Anastasia and Dr. Kingsley already mentioned, NMPH did spearhead a series of collaborative emergency preparedness activities throughout April and May, centered around an exercise scenario depicting a major earthquake happening, leading up to a full-scale exercise that took place on May 14th and May 20th. An earthquake workshop took place on April 16th that brought in subject matter experts presenting on various organizations' preparedness. The full-scale exercise on May 14th and 20th brought in involvement from various hospital partners to actively exercise patient evacuation and receiving, EMS transport, and concurrently the Regional Emergency Operations Center was stood up as well as part of the exercise, and representatives from various entities were brought in to staff the REOC to simulate support response under an incident support model. And in addition, NMPH also conducted an internal tabletop exercise with our division directors on May 16th, focusing on the agency's own continuity of operations plan, identifying mission-critical operations and services that must continue in each division post a disaster situation. So as always, after action review meetings will take place following this to identify improvements that can be incorporated through lessons learned. And then in epidemiology, May is National Hepatitis Awareness Month, and with that, we published we'll be publishing two EPI News on hepatitis, one on C and one on hepatitis A awareness. And as a reminder, the epidemiology program here conducts surveillance for acute cases of hepatitis A, B, and C, as well as chronic hepatitis B and C and perinatal cases. Our outbreaks is continuing to further decrease in May, which is good news, compared to the previous month. Currently, majority of our outbreaks are gastrointestinal illness related. In respiratory, the last few days of the season has finally ended. So as of week 20, that's May 17th. But our report will be published tomorrow because we're always a week behind in terms of the previous week in terms of our report coming out. So you will also get a season summary soon to follow that. We did have in this season a very high severity season as identified by the CDC, and our cumulative counts in flu hospitalizations in Washoe County this season was the highest we've ever seen compared to the last 15 seasons. The good news right now is that at the end of the season, all front-end respiratory such as flu, RSV, COVID are all decreasing and remaining low. And our respiratory virus surveillance dashboard, which has been updated weekly throughout the flu season, will not continue updates on flu and RSV during the off-season weeks. And we always do that as with our reports. We don't publish reports during the off-seasons. And this will start again in week 40 with the start of the new season. And our COVID data instead will continue updates because that hasn't fallen into a seasonal pattern yet. So in the meanwhile, you'll still see COVID data being updated throughout. I did also want to highlight that the respiratory virus dashboard was newly created just this respiratory season with collaboration from our county's GIS team. And this product was submitted at a poster contest at the Nevada Geographic Information Society conference in Las Vegas in April, and that won first prize for innovation. So we will continue the dashboard as the next season comes, and hopefully to make more improvements to it to benefit our community. And then finally, I just wanted to highlight our team has been collaborating with tech services to develop a database that tracks extensively drug-resistant organisms. So the database focuses on 2 high-priority pathogens, carbapenemys-producing organisms, which is bacteria that's highly resistant to antibiotics, and Candida auris, which is fungal resistance to antifungal treatments. So in addition to serving as a database to house all our CPO and CRS cases in Washoe County, this database also serves as a surveillance tool for our community. So it continuously cross-references hospital admissions data that comes in and then identify potential matches with known cases that's in our database. So when a match is found, an alert is automatically sent to the affected hospital and enable them to implement appropriate infection control measures in the hospital setting, such as personal PPE, use of patient isolation measures immediately so this doesn't spread. So currently, one hospital partner has already successfully onboarded with us and has received its first alert. Not happy there's an alert, but knowing that the system is working. Mm-hmm. And then 2 additional hospitals are also still in the process of being integrated. And we do plan on giving you a presentation on this more in detail in our next DVOH.
Thanks. Well, congratulations.
Yes.
That's really something to celebrate. I'm going to do this like number 1. That's what I'm talking about. Thank you.
And I'm happy to answer any questions.
Yep. Anybody have any questions? Dr. Danko, just want to make sure you know we're aware that you're here. Do you have any questions?
Thank you so much. I don't at this time. Thanks for checking in.
Okay, great. Well, thank you so much. Keep up the great work.
Thank you.
All right. We'll move to item 11E, Office of the District Health Officer Report. Dr. Kinsley.
Thank you. This little red light needs to be a lot brighter. But anyway, I think we all agree. But thank you.
Work on that.
Yes. I have my report before you, just a few to highlight. Today we do have the first 4 family health festivals here in our community. This time we're able to be here next door at the, I always forget what it's called, either the rodeo or the
fairgrounds?
The fairgrounds. There we go.
Fairgrounds.
The fairgrounds. So we're hosting the Family Health Festival and the wonderful opportunity to connect and increase access for our community, also provided from I believe, haircuts to access to healthcare to vaccinations to many resources within our community. That goes from 4 to 6, I believe, today. With that, and that'll be the first of 4 within our community. But overall, just wanted to highlight that, as well as overall our staff and the outreach to our community that we're doing, but open up to any questions.
Any questions? I better correct for the record. The fairground, it used to be a fair. We haven't seen a fair. Oh, you're shaking because you know. So it's technically the Reno Sparks Livestock Event Center.
There we go. I knew it was a long name. That's why I had trouble with it.
RSLEC. It's RSLEC. That was a test for me. Another test. You guys are a tough group. Thank you so much for, doing that and bringing families together and providing information. That's really great. All right, I'll go ahead and close that. Do you have? The one time I don't ask, Mr. Driscoll.
On the introduction to health movies that are getting ready to be shown to the employees, is that part of ongoing training, or is it just as they onboard as new employees? And will they be shown to other groups?
So they were recently developed by our wonderful communications team, just to streamline and provide a better onboarding process for our staff. And so it highlights and goes through that. It's usually it's part of the onboarding process. We can definitely share it with the board if you guys would like to watch it. But it just kind of goes over each of our divisions and such things, and could definitely be developed into kind of an onboarding packet for board members as well. So that's a great suggestion. We'll go ahead and take that on and then develop something for the board that you can similarly go and watch it.
Thank you.
Yeah, they're great. Thank you.
Is there a quiz after?
We can make one if you want one.
No, I'm good. Dr. Danko, do you have anything?
No, nothing for me. Thank you so much.
All right. Anything else? All right. We'll move now to public comment. Do we have any public comment?
Okay. We do not currently have any other requests for public comment.
Thank you. We'll move now to board comment. Any comments from the board? Well, thank you all for a great meeting. I'm going to go ahead and call it adjourned at 2:02.
Thanks, everybody.